Thank you very much, Robin. I'm very, very happy to be with you today. And I hope that all your families are safe during these tough times of COVID-19. And I'm really glad to participate with you today, and very glad to hear the insightful introductions and contributions. Actually, this coronavirus really has changed the mainstream ideas that we have, and we saw that some countries that are economically strong were not automatically or systematically able to face the virus, whereas other countries less rich were able to do it better. And I think that the main reason is that this virus, nobody was prepared to live this tragedy, this virus who came, and I think that the leaders and the governments throughout the world were facing, at the same time, they were seeing every day the countdown with the people who were dying, and at the same time they had to take the necessary measures quickly in order to avoid to have more death. And so I think that nobody could say that he was prepared. I mean, it's almost impossible to be prepared to this kind of things. So what we need to work on is that in the future and for the future, we need now to take into account that another pandemic like that can occur. And so we need to be ready for that. And so I think that the democracies will be able to work throughout the parliament, throughout debates and with experts and from various sectors in order to find the necessary solutions to a potential other pandemic. And I would like to take the opportunity to talk.
You've muted.
It's unmuted.
Okay. Yes. Do you hear me?
Yes, I hear you.
We can now, yes. We missed, you said you'd like to take the opportunity, but
okay.
we missed anything after that.
Okay. So I would like to take the opportunity to talk about my country, Morocco, and North Africa in general, and bring an added value from this part of the world. So, for example, in Morocco, we have taken the measures and strict measures very early. I mean, on the 16th of March, we closed all the schools until next September. On the 13th of March, the borders and air links and services were also closed. We implemented the lockdown since the 20th of March, and we're still locked down. You can see it with my hairs, but we're still locked down until the 10th of June. And I think we're the last country maybe, and the only country to still have the lockdown until that date. And with that, we also systematically used the treatment based on chloroquine that we gave to all the patients and all their families at the same time. And with that, we have today, for example, this morning, around 7,800 cases in Morocco with only 200 deaths. So I don't know if it's because of the treatment. Of course, we cannot know because the debate is still going on, and there's so many things that happen every day. But maybe the treatment is working. We can see that Africa in general, the countries have a low rate of contaminations. They also use the treatment based on chloroquine. It's also maybe because of the weather, of the temperature. I don't know. There are many factors, but it's just to say that when we are, for example, in Morocco, we're all behind our king from the beginning. Okay, there was we called it a national union. We put aside all the majority opposition things, and we were behind our king, and we as parliamentarians we gathered to do our meetings. We gave our propositions as political parties, as political groups. We tried to help, but everyone was trying to help at the same time. And I think it's one of the secrets to be able to face a crisis like that. For example, in some other countries, I would say, like, for example, France, because in Morocco we follow very much the country of France. I mean, there was so much struggle. There was so much. I mean, the scientific community was fighting. They were killing each other, and I think that it had a pretty bad impact. On how public opinion is thinking and thinks that the government was able or not to tackle all the problems caused by this virus. Also, we implemented the online education, and it was something that was really important for us, because there are a lot of villages that are far, who don't have access to internet, for example. So we did it through the television and through the radio. So in order for people, and the majority of people, to be able to follow all the classes. Of course, it's not the best solution, but it's one of the solutions we have found. One of the key things also is that we've been able to produce around 8 million of masks every day in 34 factories, and now we're exporting the masks to developed countries. That's why I was telling you that the mainstream ideas really have changed. Now we are exporting to developed countries, and it's something really good to be able also to help the community, the greater community.
If you could begin to draw to a conclusion, Honourable Abdel. Thank you. Okay,
thank you very much. So, if I had to give a conclusion, I understood, I felt this coronavirus as like a personal message. I think that this crisis tells us that we should focus more on what is really important and what really matters, the family. I think that all the next measures taken by the government, by the governments in general, should put the human being in the core, of these measures. So I will have the opportunity during the Q&A to maybe talk more about other things. But thank you very much, and I'll leave you the floor. Thank you.